Instead of trying to remember 1,000 medications for the NCLEX, I'm going to give you 3 medications that might be on your NCLEX because this came from people that have recently taken the NCLEX and passed. Pay attention. First medication is going to be meloxicam. This is going to be an NSAID, which is a non-steroidal anti-inflammatory. It's used for arthritis, joint pain, and swelling. How it works is it reduces the swelling and the pain. What you need to know for the NCLEX is you need to watch for GI bleeding and ulcers, to watch for black stool, coffee ground vomit. You're gonna wanna take this medication with food or milk to protect the stomach. And you really need to avoid mixing this medication with other NSAIDs like aspirin, Motrin, ibuprofen, increase the risk of kidney damage and ulcers. An NCLEX question Q would be, is this patient at risk for bleeding? Next medication is going to be phenobarbital. This is a barbiturate that is used to treat seizures, especially status epilepticus, and sometimes anxiety or sedation. How it works is it depresses the CNS activity, and it calms the brain and prevents seizures. Know these NCLEX risks. So watch for sedation, dizziness, and respiratory depression. You're gonna monitor your respiratory rate. You need to keep oxygen and suction bedside. Patients are a fall risk, so make sure that you are lowering the bed in the lowest position. You're giving them their call bell. Not have any alcohol while on this medication or any other sedatives, because this can worsen that CNS depression. NCLEX question Q, safe environment. Do not stop this medication abruptly, because this can increase the risk for rebound seizures. Last medication is oxycontin or oxycodone ER, strong opioid painkiller. It's used to treat moderate to severe pain. It's extended release, so it is long acting. How it works is it binds to those opioid receptors, will block the pain signals. NCLEX risks for respiratory depression. So watch your respiratory rates. Anything under 12 minutes breaths per minute, that's a problem. For sedation and constipation, nursing intervention is going to be, you're going to want to encourage fluids, encourage fiber, encourage movement. You never crush or chew an ER release tablet because it can cause an overdose. The antidote is Oxone or your Narcan. Will reverse the opioid and reduce the overdose. NCLEX question Q, assess the pain and LOC, level of consciousness, before you give the medicine. Now hold it if the patient is too sedated or their breathing is shallow. With meloxicam, think bleeding. Phenobarbital, think sedation.